So Prakash Hospital, what are the USPs you'd say? That, from your learnings, what all you felt needed to be addressed?
Started my practice in 1986 in Noida. I was the first resident orthopedic surgeon over here. There were hardly any facilities anywhere. We started with a small nursing home where we could operate some cases. As a surgeon, all right, you earn a lot and everything is fine. The best thing is when people work for you and you direct them and you motivate them and you teach them.
How do you see, the entire AI and robotic surgery coming across?
I tell you, you are so young. I think it is something around, it was 1970, 72. In Meerut University, computer came.
Okay.
So there was a strike that this computer will take jobs of so many. And now the scene is, I hire a person, the first thing he wants a chamber or a working station and a computer.
The air pollution that Delhi NCR is going through, and there are doctors who are saying that, that's impacting bone health as well. How exactly, can you tell us? Hello everyone, welcome to Behind the Stethoscope, the podcast where we go beyond white coats and case studies and dive into the stories that shape India's healthcare heroes. I'm your host, Kalpana Sharma, and today we are joined by a name synonymous with excellence and dedication in orthopedic care, Dr. Vijay Singh Chauhan, the driving force behind Prakash Hospitals. Dr. Vijay Singh Chauhan, the driving force behind Prakash Hospital. Dr. Chauhan's journey is one of grit, growth, and great vision, from being a passionate orthopedic surgeon to leading one of the most trusted healthcare institutions in the region. Welcome to the podcast, Dr. Chauhan.
Thank you so much.
I would like to start by, really knowing about your background. Why did you choose to become a doctor, and that to an orthopedic surgeon?
Basically, I belong to a farmer's family. We come from a village and I still have legs. We come from Bijnor, district Bijnor, and still I have my ancestral house and land properties in my own village. But for study, because Bijnor that time did not have that much of educational facilities, so we studied in Meerut.
Okay.
I studied in Meerut for about 25 years. My schooling, then my MBBS, then my MS from Meerut only. So this is the background. But why I choose this profession, as you asked me, I tell you that time, I entered MBBS in 1975. We are completing 50 years. We have completed 50 years of medical journey. That time, this was the most celebrated profession.
Right.
And all toppers. I studied in GIC Meerut. That used to be one of the best schools. It was a government school, but I can tell you that was better than any government, any school that time. So, it was the most sort of profession. We were the toppers and we choose this by, it was a choice. It was not a forced thing. So it was medicine and IITians or engineering.
Right.
So I choose that time medicine because I have seen in my villages, now facilities are improving. But that time, you must believe, there were hardly any doctors, qualified doctors, hardly any specialists. I've seen females dying during delivery. I've seen infants dying during delivery. So, I wanted to be a doctor and to work upon health.
Yeah.
So this was the reason and it gave me everything.
It's beautiful that you got into this profession because you wanted to bring about a change. And, how do you see the current generation, the ones that who are coming into this profession right now? Do you feel their heart is in the right place when they're choosing this profession?
It's very difficult to answer. It differs from person to person. So we cannot, actually that time choices were few. Only those who were going to medicine or engineering who were really interested, whose IQ was good, who were talented, brilliant, wanted to do something in life.
Right.
Now what is happening? I must say that time in UP there were only 400 seats for general candidates.
Okay.
in UP. Now I think they must be in thousands, I
Yeah.
mean few thousands. So naturally when there is so much of quantity
Right.
and so much of numbers, so somewhere, I mean, that thing is missing. It will definitely miss.
Yeah.
So, but it varies from individual to individual, and that's all I will like to say.
So, you just said that it's been 50 years you've been in this profession. How have you seen the entire landscape change in the last 50 years, 5 decades?
You just cannot imagine it.
Huh.
You just cannot. Nobody can imagine it. Only who has gone through it, only that can imagine.
Yeah.
Say you must believe and understand. There was only X-ray and ECG.
Yeah.
No digital X-ray, no ultrasound, no echo, no this CT scan. Forget about MRI. I tell you, it is total transformation.
Yeah.
So we were using old techniques and old methods. Now you just cannot understand, and I can't just you explain. So, but I feel that time they were more disciplined, more hardworking, and they were compensating these investigations by their clinical knowledge or clinical acumen. That time, diagnosis was more based upon your clinical examination, clinical history, and like this. Now things are much more investigation based. I don't say, I mean.
And doctors were quite intuitive back then.
Of course, because even history is very important.
Yeah.
Patient history is very important. Family history is very important. Detailed examination is very important. Journal examination and local examination. Now, still it is being done. I don't say not being done, but not to that extent. Now, I think it is much easier to prescribe X-ray, to prescribe ultrasound, CT, bone density, MRI. So they're good. I mean, I will not blame. They are doing very good work, because that time you might have missed a diagnosis. Because like suppose that time there was tuberculosis of his spine, you will come to know only 1/3 of the vertebra is already damaged. There was no way to diagnose it earlier. Only some clue could have worked, but then you have to give a medicine which may be right, which may not be right. But now you can diagnose it in very initial stage. So it is helping us also a lot.
And there was, of course, a lot of lack of awareness as well.
See, I tell you, that time India was underdeveloped.
Yeah.
Now we are in amongst 4, 5.
Right.
So everything comes from economy. See, so I mean, I have worked in medical colleges. There was not hardly any trend of nursing home, hospitals, or I mean, your so-called branded big hospitals. It was basically, I mean, a doctor who is running a clinic, and some small, he could put some beds and doing something, and some operating also. But medical colleges were quite doing, because there were a lot of commitment and hard-working nature. And money probably was not that the criteria, what I'm saying these days.
And also, I mean, a doctor's profession in itself is, I mean, I'm sure you hardly get time for yourself. What really prompted you to actually start a hospital?
I tell you, from the background which I came, my father told to join government hospitals or some PMS, provincial medical services. But I had seen, when I was posted in PSCs during part of my training of internship, I saw there hardly any facility. So it's not money. I'm an orthopedic surgeon, but there's no X-ray. There's no theatre. If there's theatre, there's no anesthetist. If there's anesthetist, then oxygen is not there, because they were very poorly managed. So I wanted to do something where I can do what I really want to do. So I never opted this.
So Prakash Hospital, what are the USPs you'd say? That, from your learnings, I mean, what all you felt needed to be addressed, How did you change?
Actually, I started my practice in 1986
Okay.
in Noida. I
Uh-huh.
was the first resident orthopedic surgeon over here.
Okay.
So there were hardly any facilities anywhere.
Hmm.
So we started with a small nursing home where we could operate some cases. And then I worked in other hospitals, like NMC was that time, then even Kailash, even we had our own nursing home. But I was doing only those cases which were suitable to be done in a smaller place. Otherwise, I shifted them to other hospitals.
Okay.
But you always want to see the big thing is, as a surgeon, all right, you earn a lot and everything is fine. But at some stage, the best thing is when people work for you, and you direct them, and you motivate them, and you teach them,
and you can manage the whole.
And you can manage the thing. Yes. So, and then you can have a bigger team.
Right.
Right. Suppose in Prakash Hospital, I have 3 hospitals. I have so many persons. So there's a stage because new techniques have come, probably which I may not do this time because I have not been trained to do that. And if I go for the training, then who will run the hospital?
Right.
In 1998, 99, I got a visa for Texas. It was a it's a highly upgraded trauma center. For 6 months. But I couldn't go because I was making Prakash Hospital. I would have gone, if I would have gone that time, it would not have taken this shape.
Yeah.
So in life, you have to leave something.
Correct.
To get something.
Yes.
So, now we have, my son is orthopedic surgeon. We have a full team. We are doing everything.
Lovely.
So whether you do it or others do it, I think it is one and the same thing. You cannot do each and everything on your own because now orthopedics is even specialized.
Yeah.
There are hip surgeons, there are knee surgeons, there are arthroscopic surgeons, there are spine surgeons.
Right.
Right. Then there are, and even shoulders specialists.
Absolutely.
So you cannot be master of everything. You can be a journalist. I can do each and, something of everything. Right. But I cannot do each and everything. So you have to develop a team and where you can do each and everything. This is the idea. Then I had best of theatres. You will be surprised. In Noida, when I started my hospital in 2001, I can claim we had the theatres of international standard with HEPA filters, laminar airflow, and there's hardly any infection which I encountered. So I did it what I wanted to do it. So this is the biggest satisfaction. If you get a chance to do what you really want to do, that is best.
And how do you see, the entire AI and robotic surgery surgeries coming across
I
fields?
tell you, you are so young. I think it is something around, it was 1970, 72. In Meerut University, computer came.
Okay.
So there was a strike that this computer will take jobs of so many.
What's the
You will not believe, there was a strike.
Now?
And now the scene is, I hire a person, the first thing he wants a chamber or a working station and a computer. So
that's a necessity now.
Yes.
Yeah.
So I believe whatever is coming,
right,
it will be in the interest of profession, in the interest of the patients, and we can match the international standards. Now we are going to purchase even robotica for knee replacement. I'm just today evening or tomorrow evening, I will give the order for it.
Oh, lovely.
We already finalized it from Stryker.
Okay.
So anything like MRI, we have MRI, we have cath lab.
Yeah.
See, medicine is totally transformed. Long back, I think 30 years back, before Escort Heart Hospital came, patients for angioplasty were going to South Africa. There was a surgeon, Kule.
Okay.
And that time it costed 10 lakhs of rupees.
My God.
Now in India, in Noida, I think angioplasty can be done somewhere in 1.5, 1.75, 1.252.
Yeah.
So now we are not undeveloped. We are now properly developed and we are going to exceed, I think, everyone. I wish so.
That's a great thought. But, in terms of healthcare in India, while cities obviously have everything top-notch and everything else, but smaller cities, where do you see the gap? And, what do you think should be done to really bridge that?
I tell you, say, since I come from village, then I have seen Tehsil headquarters, I have seen district headquarters, I have seen commissionary headquarters. When I joined orthopedics, there was no postgraduate orthopedic surgeon in Bijnor. It was in 1984. So this was one big reason because it was an upcoming branch and very sort of branch. Now I feel specialists are available even at Tehsil level, town level, right? But again, I'm an orthopedic surgeon or a general surgeon, and suppose I'm sitting in a small place. I don't only need myself. Exactly. I need anesthetists.
Absolutely.
I need ICU.
Yes.
I need everything so that I may not be blamed that you operated a patient and you could not take good care of that.
Right.
You need blood bank, right? I don't know. I mean, anytime patient can start bleeding, so you need blood bank.
Right.
So we always feel that development is not going towards a smaller, but I tell you, now it's going. I am myself evidence to it.
Okay.
Now, I think our district headquarters must be having more than 40-50 specialists. Even towns have postgraduate physician, gynecologist, surgeon. I mean, at least common. Super specialties, I do believe. But there has to be a system. A super specialist cannot practice in a town. He definitely needs at least a district headquarters because he should have facilities. Moreover, there has to be economy.
Right.
If I purchase a robot, I should ensure that its cost at least is recovered.
Right.
You cannot operate it in a smaller town. You need more work.
Right.
So this is the reason, not other reason. But now what is happening? Super specialists are visiting. Whatever they can do there, they do it there. Whatever they cannot do there, they bring or they are referred. So there has to be a referral system. Long back, there were sub-centers, then there were PSC, primary health center, then there were district hospital, then there were medical college. Everything cannot be done by sub-center, refer to PSC. Everything cannot be done by PSC, refer to district hospital. Everything cannot be done at district, refer to medical college.
Right.
So I think this is the best thing. Say whatever you can do at town level, do it. Otherwise, you send the patient. He can be better managed somewhere else. You should not try to do each and everything at your own center. You should know what to retain, what not to retain.
True. And this brings me to my next question. I mean, because you've been in this profession for the last 5 decades, how do you see the entire, the trust that patients used to have in doctors? Right now, a lot of doctors tell me that, they're questioned because there's so much awareness. There are people, you go to YouTube, you go to Instagram, there's so much information there that somewhere do you feel that trust somewhere is wavering?
I think this is the problem of whole society. It's not only confined to the medicine profession. Trust between husband and wife, trust in families, in relation, in friends. Say, this is the problem. But what I feel, now medicine has to be evidence-based.
Right.
Previously, there were not much of facility. You will not believe when I was doing my PG, between 81 to 84, there was only one dialysis center in Mohan Nagar, in Western UP. I have seen young deaths because there were no dialysis facility. Now, that time patient never complained. But now,
it's a
you
problem
have
of
everything. So, mistrust means overdoing. Surgery is not justified but being done.
Correct.
But there are advantages and disadvantages of both the things. So
I wanted to ask you that, in fact. Heart and, the angioplasties, etc., and knee, hip replacement, a lot of people tend to believe that they are done unnecessarily. You don't need them. How would you like to address this?
I always tell my patient, when facilities of knee replacement, hip replacements were not there, so mankind was living.
Yeah.
But they accepted the
Fate.
problem. They faced the problem. If
Right.
they are limping, they're limping. If they cannot walk, they cannot walk.
Hmm.
But now they know that we have better alternative.
Yeah.
I agree, sometime it might have been avoided.
Mm-hmm.
But patient shops around.
Hmm.
If I don't operate,
They'll go for
somebody else will
someone
operate.
else.
Right?
Right.
So now there's so much of availability.
Mm-hmm.
And I personally feel its patients are also to be blamed.
Mm-hmm.
Because I've seen sometimes very young patient, 45 years, 50 years. I told that you can delete this. I think there is not.
Mm-hmm.
But still they will go and somebody will suggest.
Mm-hmm.
And maybe some bigger hospitals, a bigger name. So I think patient is equally to be blamed.
Yeah.
Previously, it was a doctor-patient relationship.
Right.
I mean, I was responsible for my patient and I did my best to my knowledge and my best to of my capacity.
Yeah.
Now, I feel there's so much of confusion on YouTube. You should do this, you should not do this, you should not overdo this, you should not eat this thing, you should eat like that.
Yeah.
So I feel, yeah, I agree partly, but I feel whatever is happening, say previously there were hardly any cars. I had to wait for my Omni in 1988 for 3 months.
Yeah.
Now you have best cars. You don't even need to open window, just press the button.
Right.
Right? I used to drive my bike and I used to kick 100 times. Now you have a but now complications are also there.
Correct.
Now, because these heavy traffic accidents are taking place and they're running at 140, 150, right? So everything has a complication.
Yeah.
You don't do anything, sit at home. So I will say, in other words, we can always be blamed, and sometimes we do also feel, as a senior doctor, we also feel that probably it could have been avoided. But you cannot challenge a decision of a doctor, whatever is the reason. Because there are always some points in favor and there are always some points in against.
Correct. Yes, true. And, coming to your practice, in terms of spine, your knee health and everything, what are the top mistakes that you see people making?
I think mistakes are much less these days. Accuracy has improved a lot because you have everything at your disposal.
Right.
But I've seen everything is not in your hand. Same condition, same age group, you operate same condition, same method.
Yeah.
One patient has very good result, other patient doesn't have that much good. So it's patient factor also. It's not only doctor factor.
Yeah.
So he can do his best, but results are you cannot ensure.
And do you also see in your practice that ailments that would hit the elderly is now more apparent in the youngsters as well? Are you seeing that? Because across these fields, it's happening in heart, be it kidney, liver.
It's a very good question you asked. Say like back pain, cervical pain. I'm seeing at very young age. Cervical spondylitis or spondylopathy or low back pain or spondylitis. It used to happen at 55, 60, 65, 70. Now what is happening? Say we are moving on fast vehicle. 70, 80, 100, 120. Suddenly you apply brake. So your body goes forward, your neck goes backward.
Yeah.
It's a law of momentum, right?
Correct.
You suddenly give accelerator.
Yeah.
Suddenly you give accelerator. So your body goes forward, you suddenly apply brake, your neck goes forward and your body is stationary. So these things are called whiplash. We call them minor whiplash injuries. If you drive from here to Gurgaon or other part of Delhi, at least 50 times you will apply brakes, you will give accelerator.
Yes.
And on highways, again there's speed breaker, there's a speed control. So these whiplash injury, you understand?
Yes.
These minor whiplash injury on daily basis are damaging our intervertebral joints.
My God.
Previously, you were running a cycle. You were walking
Yeah.
on a low velocity vehicle.
Correct.
So these were very uncommon.
Right.
Now, this is the reason. Low back pain. Say you're sitting for hours, 8 hours, computer, sitting in the bed and laptop, and you're just. So you are misusing your back.
Right.
Previously, I remember, we either walked to the school or we walked, run the cycle. So, and it was exercise. So we were not in that time things were different.
Yeah.
But now you are always, even if you have to go 200 meters, you go by car.
Right.
Or vehicle. So these are the problems, certain problems, and there is no activity, no hard work, not much of physical thing in your routine. So that's why your diabetes, cardiac ailments, they are, I think, increasing.
What about the supplements? They say, take calcium supplements, vitamin D. Then there are these new supplements that keep coming up, claiming to support your bone health. What are your comments on that?
No, you must take supplements. Your calcium requirement must be 1 gram a day.
Okay. Yes, and can that be attained through food, or you need supplements?
What quality of food we are eating these days?
That's true.
How much milk you are drinking?
Yeah.
And what quality of milk you are drinking? See, milk is the only vegetarian source of calcium and maybe some food, full grains. What we are eating these days?
Yeah.
Pizza, burger, all junk food.
Yeah.
All stored food. What we are eating, it's so much disgraceful.
Right.
See, we used to eat very natural food. Mothers used to make it with love and care, and raw thing. Adulteration was not there. You are not even sure what you are eating. Even vegetables are being given injection of oxytocin.
Right.
Even your animals, milk-giving animals, they are getting injection. Right. I tell you, this is the worst part of these days. So, from where you expect a good nutrition?
You said something, and I just remembered about the air pollution that Delhi NCR is going through. And there are doctors who are saying that, that's impacting bone health as well. How exactly? Can you tell us?
I'm not sure how it will affect bone, but it will definitely affect your lungs, your respiratory system, and you can have headache, you can have allergy, everything. Then you may take some steroid or some sprays. Then that can cause some bone health also to suffer.
Correct.
Say, I at every forum I raising this point. This population is killing.
Yeah, it's a sad state.
We are not able to manage our population.
Right. Thank you so much for joining us today, Dr. Chauhan. It was indeed a wonderful conversation. And to our listeners, stay tuned for more inspiring stories from the change makers shaping the future of Indian healthcare. Until next time, keep listening, keep learning, and stay healthy.